What is hair transplant? Hair transplant is also called as hair replacement therapy or hair restorative surgery. In this surgery, the areas in which you are experiencing hair loss, your density has thinned out or your hairline has gone on a backwards area, those areas can be treated with surgery called as hair transplant. It has been seen that there are certain areas on your head which are resistant to hair fall. You must have noticed even after the hair loss up to a severe degree, your hairs on the posterior aspect of head still continue to grow and they rarely shed off. These are the hairs which have such hormonal receptor that they are resistant to hair fall. And this is the knowledge that your dermatologist and plastic surgeon are using for hair restorative surgery. We use these hairs from the area on the back of your head and transplant it to the area where you are losing hair. You can have a very good looking hair density in the area of hair loss. Who can get hair transplant? These days it has been very commonly done procedure. Many males who are having loss of density of hair or male pattern baldness, they are going ahead with hair transplant surgery. But I would like to tell you that in females as well, for certain condition, hair transplant is done. If you are trying any medical therapy for your hair loss and still you are not getting your results and your hair loss is continuing, then you are a good candidate for hair transplant surgery. Apart from that, there are conditions like alopecia areata is an autoimmune disease in which there is patchy hair loss and hair usually doesn't grow back. So it is also a good indication for hair transplant surgery. In certain people who have lost hairs because of trauma or some sort of surgery or burns and they are having areas where they are not growing hairs, these areas can be treated with hair transplant. Hair transplant surgeries are of two types, FUE and FUT, follicular unit extraction and follicular unit transfer. We will see what are the differences between two techniques in our next video. Thank you.